Helo, a diolch am ymuno ar webinar hon. Naomi Marfell, rheolwr Canopi ydw i, ac mae'n bleser mawr i mi eich croesawu chi ar prynawn 'ma. Mae gen ni dwy sgwrs ddiddorol i chi heddiw gyda gweithwyr ioga Wyneb yn y canol. Mae'n gobeithio bydd y prynhawn yn bleserus ac addysgiadol i chi. Byddwn yn defnyddio swyddogaeth sgwrsio ar gyfer cwestiynau heddiw, felly os oes gennych unrhyw cwestiynau, rhoi nhw yno a byddwn ateb wrth i ni fynd ymlaen neu ar y diwedd. Hello, and thanks for joining the webinar today hosted by Canopi. I'm Naomi Marfell, manager of Canopi, and it gives me great pleasure to welcome you this afternoon. We have two interesting talks lined up for you today with an introductory face yoga workshop in between. I very much hope you'll find the afternoon informative and enjoyable. If you have any questions as we go along, please type them into the chat function. If we can, we'll answer some as we go, but there should be also some time at the end to pick some up as well. Yn gyntaf, hoffwn ei cyflwyno i Dr Thomas Kitchen. Mae Thomas yn gweithio fel anaesthetig ymgynghorol yn Caerdydd. Mae ganddo ddiddordeb mewn lle staff ers blynyddoedd ac mae wedi gweithio i Canopi ers dros 3 blynedd a hanner. Daeth Thomas yn gyd gyrgarddurwr Canopi yn gyhyd â Dr Jake Hard yn gynharach eleni. So firstly today I would like to introduce Dr Thomas Kitchen to you. Thomas works as a consultant anaesthetist in Cardiff. He's had an interest in staff wellbeing for many years and has worked for Canopi for over 3.5 years now. Thomas has become co-director of Canopi along with Dr Jake Hard earlier this year, and I'll now hand over to Thomas to speak on an introductory to Canopi. Thanks, Thomas.
Thank you, Naomi. Good afternoon, everybody. I'm just going to acknowledge Tommy Carr, who's got his hand up or raised his hand just before we start. Tommy, if you want to write in the chat, then we can respond to that directly to you, if that's useful. Okay, first of all, thank you for joining, everybody. It's really great to see the number of people that have joined to be with us this afternoon. I wanted to just run through some of the principles and expectations of the Canopi service with you, starting with, I guess, an acknowledgement that sharing the fact, sharing the feeling that I'm not doing okay, or that I'm not doing fine, or that I'm struggling to cope, can be a really difficult thing to do. Recognizing how we are can be difficult enough. Staff feeling that they're letting others down, staff feeling that they're losing part of their identity, or feeling embarrassed, or feeling fear or shame about telling somebody else, all stand as barriers to accessing help when it comes to our mental health. And if or when we manage to speak to someone, then the question I really want to ask is, well, what is there out there that can help? Well, sometimes a conversation can help in itself, the opportunity to structure our thoughts, to decompress a story, to share it with someone. But sometimes we need more than that. And the challenge then is, well, what if we could create a service that gave NHS and social care staff access to specific, individualised, high quality, effective and individually tailored mental health interventions? And we could do that in a timely way. What if those services were available to everyone, whoever you were, whatever pay scale you were on, whatever your employment or your profession, that it might be an equitable service? What if we could support everyone working in health and social care in Wales to feel like they could access that service without fear of judgment, without stigmatisation, without shame? And delivering across those 3 questions in a real and tangible way is what we're trying to do at Canopi. We're trying to provide timely access, equitable access, confidential access, a place to come without fear to mental health and support services, that individuals can disclose their mental health concerns in a supportive and safe place. Why are we doing it? What's the point of Canopi trying to do these 3 things? Well, we know that if we give people the right support with their mental health challenges, and often people already feel they know what they need, but if we can do that in a timely way, we know that that has a positive impact. And that positive impact reaches beyond that person, beyond that person's own experiences. If we can treat and support someone before they feel they need to leave work, or before they have been off sick for more than 6 weeks, we know that they're significantly more likely to be back in work, back at work, contributing their skills, their expertise, their experience. And so by doing that, we can build an expert workforce that has memory, that has connections. If we treat and support someone in a way that demonstrates compassion, that demonstrates to them that we have heard their story, that we're willing to make an investment in them as a person, by doing that, we build them up as an individual. If we treat and support someone and prove to them that disclosure of their mental health challenges and symptoms hasn't resulted in what they've catastrophized or over-ruminated upon, that they didn't lose their job, that they didn't lose their family, if we can do that, then we can build trust. These are the things that Canopi's trying to do, and many of you on this call will already know how we're trying to do that. The service itself is trying to do that. We're trying to increase awareness of Canopi across this country, across other countries in the UK, and we're trying to make sure that as many people have heard about us as possible. The service itself is an open access online referral portal. That's how to get into Canopi. Once somebody's accessed the service, then a trained doctor advisor will speak to them and work with the client to form a co-produced signposting schedule. That might be to self-help resources that we've looked at and reviewed in the past. That might be to support from our wellbeing allies who are experienced volunteers. That might be to guided self-help therapies like Spring for PTSD or Silver Cloud as an online-based platform. It might be through to our specialist alcohol use disorder assessment service. It might be through to virtual or face-to-face therapies. And all of that from a Canopi perspective is surrounded by robust service and management data to demonstrate the effectiveness of the service that we're providing. The other thing that we're seeing is that the presence of Canopi is growing, as it were, across Wales. So in the last few weeks, we've seen 1,700 people visit the Canopi website in a week. That's nearly 7,000 people coming to the website every month. If I can direct you to that website as a place to find out about Canopi, about what we're doing, to keep an eye on our website for blogs and updates about the service, about stories of lived experience, about information relating to health and mental health more generally. And we're present at meetings, we're present at conferences, we're trying to get out into the places where people who are working might come. So if there's something that we can do to support your workforce in a way that is positive in terms of promoting Canopi, then please do get in touch. And the reality is that these efforts that we've made through our website, through the service promotion, through being in different places, is that the service is growing. Last year, the service saw and supported 2,500 members of the social and healthcare workforces across Wales. Currently, we're seeing about 70 people come to the service per week, which, for those of you who can do the maths quicker than I am, is already more than 2,500 people expected in this year. And I'd like to just focus for a moment or two on this growth, on the growth of Canopi, because there's a great story, there's a good story, and there are some challenging stories and aspects to the growth of the service. Growth across the social care workforce has been great. In the first year, 350 people from social care in Wales came to the Canopi service. And again, we're seeing that number grow this year. People coming to the service have predominantly identified as coming from local authorities as the sector of work, but we're starting to see that the number increase from independent and third sectors. We're reaching out to more people in social care. We're well aware that some of the most vulnerable people working in social care are those people that are working in very small teams or even independently. And those are the people that are hardest to hear and hardest to reach. In terms of the social care growth, we'd particularly like to thank our colleagues in social care in Welsh Government and in Social Care Wales for their support. But we're really keen to continue to raise awareness across this sector. Canopi is here to support social care workers, everybody working in the social care sector in Wales, with a free and a confidential support service. What about growth in healthcare clients then? Well, the number of healthcare clients accessing the service also continues to grow. And while we're trying to support this seemingly ever increasing number of people, it's important for us to recognise just for a moment the limitations of our capacity. In short, Canopi is running near to its capacity. And as we try and offer timely support to those who don't feel they can access service support elsewhere, we're really mindful of how we can continue to deliver a timely service to them. So we're working with HRW and individuals from different health boards to look at creating a national signposting space, first in the healthcare sector, and then maybe in the social care sector, making sure that we can try and get the right person to the right place, recognizing that Canopi is only one small part of that network of support. Supporting people then to get to the right place at the right time is really important. Canopi's specific goal is to try and help those people who don't feel able to reach out to other places. And so for people who have already disclosed their concerns to another service, then we'd like to think and hope that they'd already found somewhere that they can trust and somewhere that can support them through the challenges that they're facing. Alongside growth in numbers, then we're seeing an increased severity and complexity in the presentations of clients coming to the service. More people are presenting with more severe presentations. How do we measure that in Canopi? Well, we measure their GAD, their PHQ and WSAS scores at their initial assessment. Those scores are going up. It's important to mix those scores into the presentations that people come with, but we're seeing more people with complex past mental health histories, with complex medication histories. And a lot of the severity also has a significant chronicity about it. People have been suffering these things for a long time. The hope is that this represents in some ways a willingness of people to start talking about their mental health more openly. Maybe we are breaching some of the stigmatization that does exist in healthcare and in mental health particularly. It also highlights, though, the stresses that the community and the primary mental health care services in Wales are experiencing. When people come to the service, despite this severity, I think it's important for us to just reflect for a moment on the fact that the workplace seems to be the main precipitating factor. People are coming to Canopi with workplace-related precipitating events. This is the most common thing that we see. And I guess with this opportunity to reach out to a slightly different audience today, I ask, across what we're doing, across the different places that we work, how can we develop supportive, compassionate and caring environments for our staff to work in, such that the workplace doesn't become the precipitating factor in the individual and their mental health concerns. What about Canopi looking forwards? We're really excited to be exploring how we can further develop Canopi as a service by diversifying our therapeutic options to clients who access the service. What have we been doing in this space? Well, we've been looking at lower intensity therapeutic interventions in terms of what we've described as therapist-guided CBT. This is to try and reduce the number of people accessing or needing to access longer programs of CBT. And the work that we've done here has been really encouraging, led, I suppose, initially by the ideas established through John Bisson, the previous director of Canopi, who established the Spring service, a virtual PTSD service with a therapist-guided approach, recognizing that with space to tell a story, space with an accredited therapist to lead us through particular exercises and understand thoughts and skills a bit better, then we can achieve significant outcomes with much less resource. We've tried to mirror some of that learning from the Spring programme into our therapist-guided CBT programme, recognising that for particular disorders, for example, around anxiety-based disorders, we can, in a much more cost-effective and therapeutically effective way, manage clients who are presenting to Canopi over much shorter time periods. The outcomes have been really positive for the pilot programme around this that we've run, and we're really excited to try and develop this area a little bit further as we go into the next weeks and months, into the next years of Canopi. We're also really excited to continue to grow awareness of the service, particularly in the social care sector. How to understand better how to support our vital health and care services by supporting the most valuable asset that we have, which is the workforce. there's no possibility of looking back. All we've got to do is look forwards. So how can we support that service? How can we support awareness of the network of available options to people who are struggling, whether that be through local employer-based services, whether that be through other national schemes like Able Futures, or our professional-based schemes like the BMA. We're really keen to try and build this network of support, at least with our third sector colleagues, those people who provide very specialist support for challenges that people might face, for example, through domestic abuse or relationship challenges or financial difficulties. We recognise that there's a lot of challenges across this spectrum that occur as we go through life, but at the moment with the cost of living crisis, perhaps are being pinched to their pinnacle, requiring people to present and seek extra and additional support. I wanted to keep our session around the introduction of Canopi brief, such that we can try and take some questions if there are any. But I think it's important that we can't finish without thanking the huge number of people that are involved in supporting and delivering the support that Canopi offers. Canopi has genuinely grown from a very small seed, a system, a service, a few years ago called Health for Health Professionals Wales, that supported just doctors, through the vision of people like Professor Debbie Cohen, Professor John Bisson. Canopi has grown into a national integrated mental health support service for health and social care workers in Wales. And I think that's a huge achievement. So we thank them for their vision, and we would like to thank those that have made that vision possible, particularly our ministers, the deputy ministers in Welsh Government, to the chief medical, nursing and social care officers that help us to deliver this work, to the teams across Cardiff University that support the administration of the service, to our comms team, to the help desk team, to our service manager, to our doctor advisors, to our wellbeing allies, to our therapists. As we make that list, we recognise that there's a huge number of people involved in supporting this workforce. And I think it's really important that we thank those people for the work that they do. This service wouldn't exist without you, and we're very grateful for the care and the compassion that you bring to the clients that come through the Canopi service. The reality is, however, that we know that there's a lot of people working across healthcare and social care that still don't know about Canopi. It's a real challenge, from the very leadership of some organisations to the people that are at the coalface delivering care. How do we reach them? How do we tell the people or make aware the people that we need to be aware that Canopi exists to support them? Because the reality is that we're trying to reach perhaps the person who won't tell anybody that they're struggling. How can we ensure that they know about Canopi? And so I wanted to finish with two asks, two things that I'd like to ask you to think about how you might deliver these in the places that you work and the workforce that you support. How can you tell someone about Canopi? Who could you tell about Canopi that might not already know? Perhaps you could put up a poster. Perhaps you could share a postcard. You could put something on a screensaver. You could have a link to our website. Perhaps you could download something from the resources page. How can you share with the workforce that you support the principles, the opportunities to contact Canopi? Where could it fit? Because the reality is that we want to raise awareness such that in the moment that people decide that they'd like to reach out for help, they already know that Canopi exists. A quick link would be to our website, which is Canopi. If you Google that, it will come up, but canopi.nhs.wales. There's a huge amount of resource on that site, and we'd be grateful for any links, for any references that you can share with it. As I said, I've already referenced the wealth of material that's there in terms of the blog pages. So the question is, can you tell someone about us? And if you can, who can you tell and how can you tell them? My second ask is more individual to you as the people that are listening to this or to the recording of this session that we're putting on. If you or someone you know might be interested to join our brilliant and amazing team of wellbeing allies, our volunteers who offer their time to create safe listening spaces for our clients, then please get in touch. We'd be really grateful to hear from you. It is a fantastic team of people, and they do brilliant work. If that's something that might work for you, then please do get in touch. As I say, the website is the easiest way, or you can email any of the team via the Canopi email. So, 2 asks. The first is, how can you let everybody know, or how can we make sure that as many people as possible know about Canopi? Can you tell somebody specifically about us? Can you put up a poster somewhere? Can you put something on a screensaver on a website? And the second is, do you have the capacity? Might you be interested in joining our team of wellbeing allies? If you can, please get in touch. So, Canopi's here to support the confidential and supported disclosure of mental health concerns for the NHS and social care workforce. We've had what we think is a brilliant year, reaching more people than we've ever been able to reach before. We recognise there's still some more work to do. We're really excited to do that work. We thank you for those that are involved already in delivering it, and look forward to picking up questions or hearing what you think about us, either through this session that we're doing today or through your contact through the website. So thanks for your time, and I hope that's been a useful introduction to what Canopi is trying to achieve.
Thanks, Thomas. I don't know if you want to pick up a question from the chat at this point. I think we've got a couple of minutes to do that.
Yeah, smashing. So that's a question from Tommy Carr. Thanks, Tommy, for your question. The question is, just in case people are listening to this and can't see the question at another time, how do you think Canopi compares to the website address here is Practitioner Health in England and the Workforce Specialist Service, WSS, in Scotland? Is Canopi just for staff in Wales, or can staff from other nations access it? Tom, it's a really helpful question. So Canopi is a service for people working in Wales. NHS Practitioner Health, as you point out, runs a similar service in England, and the Workforce Specialist Service runs a similar service in Scotland. We'd really encourage those people to access the services in their locality, as it were, in their devolved nation. There are some specific differences between the services in terms of who can access different services, but if you work in Wales, in NHS or social care services, then you can access Canopi, and I hope that answers your question. As I say, there's a little bit more information around that if you want to contact me directly, and it's useful to you, but hopefully that answers it for everybody else. Well, there's another question here from Jane Bell. I'll pick that up now. Just briefly, in terms of the question from Jane is, do you have any data on which disciplines or staff groups are predominantly using your service, and are any disciplines more frequently represented than others? I think this is a really important question, Jane, because I reflected in the short introduction I gave that we were historically a doctors-only service. And what we've seen in Wales, which is different to some of the other services in the UK, is a real growth in what I think is probably more proportionately representative now of other professional groups coming to the service. So at the moment, the most frequently presenting group of professionals coming to Canopi are nurses. And that would make sense, given that we have a proportionate size of nursing workforce in Wales. So we are open to professional and non-professional groups, and we see people from non-professional groups as well. We're probably slightly underrepresented in non-professional groups in terms of the size of that workforce in Wales, and we're really keen to have, as I say, to raise awareness among those groups, among different professional and non-professional groups in Wales. If there's more specific data that you would like to access, we really welcome the opportunity to share some of that with you. And if you'd like to contact us directly, we can do that. Thank you very much, Julia, for pointing out in the chat the annual report. That can be accessed as per the link in the chat at the moment, or via our website, and that shows a breakdown of some of the other groups and professionals that are accessing the service. There's another question here, Naomi, just keep us on track in time if that's okay, relating from Alison, or coming from Alison, who works as a union rep. Thank you, Alison, for sharing details of the Canopi with members of the union that have come to you for help. We have tried in the past to link with unions, and we'd be really happy to share information with any union that represents health and social care workforces, as we try and, as I say, just build that background awareness and knowledge of what Canopi is trying to achieve across the country.
Thomas, I think that's probably a great time to stop. If there are any more questions for Thomas, we can always pick those up at the end. So, diolch Thomas am fynd â ni drwy gyflwyniad I Canopi. Hoffwn ei cyflwyno I John Bruno na. Mae John Bruno yn hyfforddwr personol gyda dros 30 mlynedd o brofiad. Bydd John yn cyflwyno gweithdir yoga wyneb o'r studio iechyd yn Penarth sy'n cynnig ystod o dosbarthiadau hyfforddi personol a rhyddfydd gan gynnwys Pilates, yoga, heddwch nordig ac heddwch nordig. Thank you, Thomas, for taking us through an introduction for Canopi and for answering some of those questions. Much appreciated. I'd like to now introduce you to John Bruno. John Bruno is an experienced personal trainer with over 30 years of experience. John is going to be delivering an introductory face yoga workshop for us from his health studio in Penarth, which offers both a range of in-person and virtual training classes, including Pilates, yoga and Nordic walking. I'm going to hand over to John, and I think we'll be turning my video off at that point. No offence, John. So thanks very much.
Hi, everybody, and I'd like to thank Canopi for inviting me on to this this wonderful event. So my name is John Bruno, and thank you for the introduction. So we're going to do an introductory to sort of face yoga. So you're quite welcome if you want to join in some of the exercises, or just sit back with your cup of tea or your drink and chill out. If you are wearing glasses for some of the exercises, you can take those off if that's okay. So a little bit of background with face yoga. I've been a personal fitness trainer now for 32 years, and I've always sort of exercised quite a lot, and then Pilates, Nordic walking, etc. But I've always thought that we don't look after our facial muscles, and I've known about the concept of doing facial exercises. So 12 years ago, I came across a lady in Bath called Danielle Collins, and she did a face yoga course. So I attended, and I was smitten. I thought this is an excellent concept and an excellent way of actually sort of looking after your facial muscles. If we think about going to the gym, we use our sort of big muscle groups. So we do cardiovascular exercise, we do strength conditioning, we do core exercises, but we sort of lose and not use our facial muscles. And we have 57 muscles in the face. So obviously we carry all of our expressions during the day through that, everything from smiling to frowning, to sort of, different attitudes as far as the day's concerned. So the idea is for that awareness of these facial muscles, and also then to look about sort of conditioning them. So the first thing we're going to do is just do a nice little relaxation, and we're going to think about our facial muscles. So we're going to come into a nice posture position, and we're going to close our eyes just for a few seconds. And then from there, I want you to just take a nice deep breath in through the nose and out through the mouth. So as you're breathing in, you just feel your chest cavity raising. And then as you exhale, your shoulders relax. So it's important, especially from a mental health point of view, just to take some time to do some really nice sort of deep breathing. And as you're doing these deep breathing exercises, I want you to be aware of your facial muscles. So we're going to ask this question at the beginning, and we'll ask it at the end to see if there's any difference. So how do they feel at this moment in time? Do they feel cool? Do they feel warm? Do they feel tight? Are you not that aware of them? How does it actually feel to think about your facial muscles? Sometimes we think about our posture, but sometimes we don't think about our facial muscles or how they feel. So just taking a nice deep breath in, simple breath out, thinking about those facial muscles. Okay, so we're going to run through a series of different, you can open your eyes. We're going to run through a series of facial exercises, and I'm going to show you a few slides with the muscle groups that we worked, and also a couple of different explanations, and then we'll go into the second part. So we're going to start off with your forehead muscles, your frontalis muscles. So from here, we're going to form a nice little C shape. We're going to place your fingers on top of your eyebrows and then just underneath. And the idea is you pull down your eyes slightly, but at the same time, you raise your forehead. The idea is you're trying to work the muscle in the front of the forehead. And the only way to do that, to stop them from crinkling up, is to actually hold them in place. So you've got your hands in this position, you're pulling down and you're lifting up at the same time. And just take a nice deep breath, sort of in and out as you work this forehead muscle. That's good. So you can just feel that muscle trying to contract, but the idea is by pulling down on the eyebrows, it stops the muscle from contracting. The forehead muscle gets used quite a lot, especially when you're concentrating in front of a computer. We'll do that once more. And rest. Okay, we're going to now work the muscle just between the eyebrows here. So the idea is you take your fingers to the outside, and you just pull slightly, and you can feel a little stretch. And just hold that position. And whilst you're holding that position, I'm just going to explain a few things. So when we're using our forehead muscles, or any muscles in the face, obviously they're contracting, relaxing. And when somebody has Botox, what happens is those muscles start to relax, or they don't actually work, and that's what helps the muscle sort of go back to its original position. If you can start to think about switching the muscle on and off, as in doing these different exercises, what happens is the muscle starts to relax. It's almost like doing sort of a nice postured yoga class or Pilates, where you start to condition the muscles, and also at the same time, what tends to happen to the muscles, they tend to relax, they go back to their normal length. And rest. Okay, let's take both hands just up onto the forehead. And then from here, we're going to just do a little smooth the brow. So we just work those muscles a few times. Good, we do that a couple more times. And rest. So from here, we're going to now work into your eye area. First exercise we're going to do, you're going to just tilt your head slightly, don't impinge on the back of your neck. We're going to take your fingers, we're going to take fingers to the inside and to the outside of the eyes, and then you're going to look up towards the sky or the ceiling, and then you're going to squint, and you're going to hold that position. So the idea is we're holding around the inside, the outside of the eye, and as you try to lift the bottom eyelid up to the top eyelid, you can feel the muscle groups just underneath the eye starting to work. If you do this correctly, you'll find them just almost like vibrating slightly, where they're contracting. Let me just hold that position. We're going to do this a couple of times. Just relax a second. Just come down, take your fingers and just to the inside of the eye and just sweep across, just to relax that area. Good, we do that once more. Okay, we place the hands to the inside again, but look up towards the ceiling or the sky, wherever you are. And then from here, we're going to contract those muscles again, and I can feel the muscles looking up, and you can feel the muscle just underneath the eye here. What it does, it tends to flatten that area out over a period of time. So just hold that position. And rest. Okay, bring your fingers to the center again. You do that little sweep across the eyes. As I said in the introduction, we have 57 muscles in the face, and we use them quite a lot sort of during the day. I think for me personally, when I just sort of started to look into face yoga, the one thing it really did for me is just to take time during the day just to think about how my facial muscles are. You know, if you're doing lots of work in front of the computer, lots of stressful work, you're sitting in front of the TV, you tend to lose that sort of function of your sort of facial muscles. So they lose their structural integrity, and also at the same time they get tight. So just by doing some of these simple exercises means that you can sort of relax the muscles and also condition them at the same time. So we've got one more little exercise to go before I go to a few slides. So from here, we're going to do an exercise called shift the eyes. So the idea is that you're going to look, if you put your finger in front of you, you're going to follow your finger to the outside and then back to the center, and then we go the opposite side. We don't tend to use our muscles in our eyes as much as we should. The reason being is we tend to use our head when we look from side to side, but actually we're looking to be able to use your finger or your thumb and just follow from one side to the other, nice and smooth, nice controlled. Sometimes our eyes tend to jump, so they go quickly from side. We're trying to do this nice and slow, nice controlled. So a little bit of movement, side to side. Okay, so let's do that from top to bottom now. So without using your finger, we're going to look up towards the ceiling. Head's going to stay nice and stable. So you look as far as you can up, and then you follow all the way down to the floor and then up towards the ceiling. Back in the 80s, I did some chauffeuring for an executive car company, and I had an American lady, and she was doing all these strange and odd sort of exercises in the back of the car whilst I was driving, and they were facial exercises, and that was back in the 80s. And the one thing she did do was lots of eye exercises to look after the muscles in her sort of eye area. I'll do that one, small and resting. Okay, we're going to do some peripheral vision. So it's not necessarily a facial exercise, but it's a really good way of working on your peripheral vision, and also it can be really relaxing. When we get stressed, we tend to go into ourselves. We tend to sort of focus in the moment in whatever we're focusing on. If it's stressful, by doing a simple peripheral vision exercise, so thumbs to the front, and then from here, just taking the hands to the outside. The idea is you're looking at the screen, but you're actually following your thumbs at the same time. So we tend to get stressed. We tend to go in a bit of a tunnel vision. So by doing a simple exercise like this, just takes our vision away from focusing on the front. We're going to do that one, small and resting. Okay, little acupressure exercise. Just get your fingers and just tap around the eyes. So we concentrated on doing some muscles in the forehead and around the eye area, so the smaller of the muscle groups. Wonderful. Well, I hope you enjoyed yourself. I'm just going to show you a few slides that I put together just on some of those exercises, so you can see the muscle groups that we've just worked. Excellent. Okay, so this was the first exercise we did. So we worked the muscles to the top of the forehead, which is called the frontalis muscle. And the idea is by conditioning that muscle, the muscle is being able to contract, but also the most important part is to be able to relax at the same time. Then we went on to another exercise just for the center, this little center muscle that tends to tie up a bit too much when we're concentrating. The idea is that you're, again, lengthening the muscle in between. By lengthening the muscle in between, you can actually relax that muscle. Smooth the brow was just a nice little circulation exercise to be able to release any sort of tension in those muscle groups after we've done that. So a fact, it actually takes 12 facial muscles for a genuine smile. Interestingly, we lose the ability to be able to use lots of muscle groups as we get older to smile than we do if we were a baby. Babies have an amazing ability of having lots of muscle groups when they smile. We tend to lose that as we get older. So when you smile, smile with the whole of your face, just not with you. This is an interesting little presupposition of mind. The mind and body are part of the same system and affect each other. So the idea is if you're, as I say, if you're a bit down or you're feeling tense about something, we tend to carry that in our faces. And we just know that from colleagues and friends and family. You know, when somebody's maybe a little bit stressed or they're joyful, you'll see it in their facial muscles. So sometimes by changing your thought process of how you feel facially can actually just move you on from where you are in that state of thought and also state of being. We did the exercise called the V, which is the exercise that works around that sort of bottom part of the sort of eyelid. So it's really good, again, for toning up that area, but also relaxing. Shifty eyes, where we look from side to side and us up and down. It's important to keep the ability to be able to keep those muscle groups in the eyes really strong, but also sort of fluid as well. And we did a little acupressure exercise to finish that off. Okay, we're going to go into the second part. Hopefully at the end we'll get some questions going to see if anyone's got any interesting thoughts over these wonderful little exercises we did. Okay, we go back into our really nice posture. We have an exercise called the hamster cheeks. This is really easy to do. So the idea is you imagine got some water in one of your cheeks and you can transfer it from one side to the other. So you blow one cheek out. I'm going to have to close my mouth for this one, hope you don't mind. And then from here, you swap from side to side. You can actually do this with sort of water if you want to. The idea is we're hoping to sort of really fill this area out with a bit of compression and the muscle comes back the other way. So you get a bit of tension into the facial muscle. So I'm just going to do that a few times. You can join in. Let's get moving from side to side, just filled in that facial muscle. And the muscles in this area, in your jawline, are the biggest muscles in your sort of facial area. So they can actually be worked really well. So let's do that a few sessions, a few more times, sort of each side. That's good. We'll do that another 20 seconds. I want you to really feel these muscle groups work. Okay, and then I'm going to rest there. Okay, the next one, this is called pufferfish. So this time we're going to blow both cheeks out like a pufferfish. And then from here, obviously mouth is closed. And then we're going to tap with our hands on the side of the cheek. So I'm going to do this again. I can have my mouth closed. So from here, closing the mouth and that's good. You keep going, keep tapping yourself on the sides of the face. When it's almost like tapping a drum. What happens is the muscle group in the side of the face is sort of contracted and you're trying to sort of decontract it by tapping on the side and it stays nice and full and nice and strong. Just keep doing that. I want you to really feel this muscle group sort of working really well. Just going to do that for another 20 seconds. And you can tap around a little bit higher if you want, down into the mouth area. So tapping around, keeping that. That's good. Some of these exercises are a bit funny, but such is life. We have a bit of fun, bit of a laugh, and resting. Okay, from here, we're going to take our hands and just kind of have a little pinch over the cheek area. We just work those muscles. So just going to do a little relax. Nice little pinch around. I think it's we're talking about mental health. We're talking about sort of having a little bit of time for yourself and, doing a little face yoga exercise session each day, even if it's a couple of minutes. So all the exercises do take about 20 minutes to do, but you can break them down into little parts that I'll come to in a moment. And resting. Okay, we're going to move into a few more exercises. We talked about fun. This is probably the most fun exercise we're going to do. So the idea is you're going to raise your head up slightly. You're going to take your hands onto your collarbones here. And then from here, this is fun, you're going to kiss the sky. So the idea is from here, I remember the first time I did this and I did have a giggle and I thought, how am I going to be able to teach this? But the more you do it, the more fun it is. So, but just keep doing it. We're going to do this for 45 seconds. And the reason being is I want you to feel how your lips feel when you do this. So you just you feel the front of the neck working. So you feel the muscles in the front of the neck. underneath the neckline and also into the lips as well. That's good. If you think this is a bit mad, that's probably is a little bit in a fun way. That's good. We got 15 seconds left. That's good. Last few seconds. And resting. So if we, I know that was a bit of fun, but if we think about that lip area, we don't tend to work the mouth as much as we should. So thinking about as we get older, it happens with all the muscle groups of the body, unless you condition them, that we actually lose that strength, and also we lose mass, and the muscle will naturally atrophy if we don't use it. So by going to the gym, as we probably do, and doing different activities, we hope to retain some of that sort of bulk and that muscle. It's the same with your facial muscles. If you don't use them, you're going to lose them. So the idea by doing something as simple as that, you'll have thicker lips. The reason being is the muscles are working. The muscles are not atrophying as you get older. They're retaining some of that strength and that some stability. Our muscles in our face and also our bones in our face gets smaller as we get older, but there's no reason, especially from a muscle point of view, we can't retain some of that. So that's one of the reasons by doing something as simple like kissing the sky, we can work the muscles around that lip area. Okay, we're going to work into our jawline. So we're going to take your fingers and we're going to have a little pinch up the jawline. So we're going to pinch up and down, just stimulating that area. It's good, nice little pinch up and down. Okay, and then from here, get your thumbs. I'm just going to come up the jawline towards your ears. Okay, we'll do that once more and rest. Okay, we're going to place your hand just underneath the chin. We're going to have your chin in a nice neutral position so we're not pushing down. And the idea is you're going to hold that position and then you're going to push your chin down towards the floor, but still keep neutral position. So the idea is you don't bring your head down. You keep, by doing that, you can feel the muscles in the neck working really well. So don't hold your breath, just take a nice deep breath in and out. Good, we do that for 10 more seconds. You feel that tension in that neck area. If you touch underneath the jaw, you can feel the muscles working as well. So just like any good gym routine, you do a conditioned exercise and then you try and stretch and relax and mobilize. So we're just going to have little relaxation exercise. So from here, just tapping underneath the chin, just after using those muscles. And rest. Okay, from here, we're going to take your head to the side, and just look up towards the ceiling, and then come back to the center, and then go to the other side. So from here, a nice simple, just be careful with your neck, just simple neck mobility. If you have neck mobility issues, just working within the parameters that you feel nice and comfortable. Okay, we'll do that once more each side. We'll do that once more. And rest into the center. Okay, next exercise. After finishing Danielle Collins' sort of course, what have you, I had different ideas of what I could do as far as doing some exercise during the day. So, you know, things like being in the shower, you can sort of kiss the sky, you can do puffer fish where you're sort of blowing cheeks out. So there's simple things to do. Could do those when you're driving a car, might think you're a bit odd, but that doesn't matter. So there's different things you can do. So instead of going through a full routine, sometimes I'll break some of the exercises, just everyday sort of activities. And the one thing I tend to do when I'm in the shower in the morning is to do something which I call aerobic face. And the idea is just to wake the muscles up of the morning, sort of, you know, had a busy day the day before, slept, get up and just want to wake the whole of your body up. So from here, just moving your facial muscles around. So just moving your lips around in your cheeks, and almost, I always think of it, it's almost like going for a little jog. You're just trying to wake those muscle groups up. You're not doing anything strenuous. You're just trying to do those. So just moving the muscles around, different muscle groups moving and working around. And the other one that I'll do during the day, and sometimes I'll set my sort of timer to do this. It's almost like doing if you're working at a desk. So let's think of this concept. You're working at a desk during the day and you're doing lots of activities. It's quite sort of stressful. You tend sometimes to get unpostured. So sometimes you'll come up and you'll just have a little stretch out and sort of posture yourself, have a little move around, make sure you're not sort of affecting your back and your core, etc. I think about my facial muscles doing the same thing. So I'll sit there for a couple of minutes and I'll semi-contract the muscle. It's almost I'm trying to go into a postured position with my sort of face. So I'll just contract the muscles slightly, just to wake them up a little bit and keep them there maybe 5 minutes. This is a really nice way. Obviously concentrate on driving, but sometimes I'm in the car and I'll just contract those muscles up sort of slightly. Does that make sense? It's almost like having a bicep and just sort of contracting it slightly, just putting a bit of energy into those muscles, because sometimes we'll sit there, be on the steering wheel, in front of a TV, in front of a computer, and we'll let those muscles just go boom, and they'll just relax. The same type of thing as unpostured muscles are not good in your torso. Unpostured muscles in your face are exactly the same. So that's the idea. You want just to condition them a little bit more. So just try and be aware of those facial muscles. I think for me, that was the biggest thing. It was the awareness of how my facial muscles are during the day. And I think I lost a lot of tension, especially through sort of forehead and sort of frowning and such, just by doing some simple facial exercises. Okay, I'm going to show you a few exercises, then we'll conclude. Maybe we can have some questions then during the coffee break, if that's possible. Okay, let's share screen. Excellent. Okay, so we did that exercise called pufferfish, where we sort of have a little hits at the side of with the hands from side to side. They're using one of the bigger muscle groups in the side of the face, so that's a really good and fun exercise to do. We did our rosy glow as well, where we pinched around just to get a bit of circulation after doing those exercises. Kiss the sky. I bet there was loads of people laughing at that, but couldn't hear you because you're on mute. But that's a really good exercise. Before the end of the week, I want you to do that for 5 minutes continuous. You don't have to kiss the sky; just do it to the front, if that makes some kind of sense. So you'll feel your lips on fire after that one, like having a good shoulder workout. We did our little jaw exercise. The jaw muscles are the strongest muscles in the body per sort of radius, if that makes some kind of sense. They're super strong, but also they get super tensed up as well. So by doing jaw toner exercise, just releasing those muscles makes a big difference. Jowl buster. So that was the one where we put your hand underneath and press your head down. You can feel those neck muscles and the muscles underneath the chin working. Aerobic face. So the idea of the exercise is to engage as many muscle groups as possible in the face, and to do that for at least sort of 5 minutes. And then we had I call it face posture, where we're thinking about actually having those muscles just in that nice, simple sort of contracted state. And the reason being is that we can just condition the muscles any time of the day, whatever we're doing. Excellent. Well, I hope you enjoyed your little sort of introduction to face yoga. I do offer little sort of free workshops on things like face yoga, introduction to Pilates. So if anyone's interested in, I'm sure we can sort out a little link. Yes, I just had a thank you. That was from Sarah. So any thoughts, any questions? Obviously, you can send those through to the team. But thank you kindly, and thank you for Canopi for letting me be involved with this. It's been really enjoyable. Thank you, everybody. Thank you kindly.
Thank you, John. I can't see any questions just right now. So diolch John am y gweithio hwnnw, roedd o'n wych a ddiddorol iawn. Thank you for the workshop. I really enjoyed it. I'm going to try and remember to do lots of those exercises going forwards. And yeah, enjoyed many of them. Thank you.
Excellent. Thank you, Naomi.
No worries. Just looking at time and the chat function. So Rydym nawr mynd i'r cymryd egwyl bach tan 2:15. Bydd John yn aros ar-lein yn ystod yr egwyl I ateb unrhyw cwestiynau. So we're going to take a short break now until about 2:15. Understand John's going to stay online. So if you do have any questions over that break, please pop them in the chat and John will answer those for you. If not, we'll see you back online at about 2:15. Thanks very much. Wel, croeso nôl, gobeithio cawswch chi egwyl braf. Bydd ei sesiwn olaf yn cael ei chyflwyno gan Jeremy Brown. Mae gan Jeremy brofiad gweithreddol yn y sector masnachol a gwasanaeth iechyd. Jeremy yw rheolwr gyrfarwyddwr cartrefi gorffal Christadelphian a chadeirydd United Welsh. Mae Jeremy wedi bod yn aelod gwerthfawr o'n grŵp cynhori arbenigol ers tua 2 flynedd. Mae Jeremy yn mynd i siarad i'n heddiw ar safbwynt gorfal cymdeithasol. So welcome back. I hope you had a nice break. Our final session this afternoon will be delivered by Jeremy Brown. Jeremy Brown has executive experience in both the commercial and NHS sectors. He's the Managing Director at Christadelphian Care Homes and Chair of United Welsh. Jeremy has been a valued member of our Specialist Advisory Group for coming up to 2 years, and he's going to speak to us today on a social care perspective. Thanks very much, Jeremy.
Thank you, Naomi. Hopefully people can hear me. I'm sure I'll get feedback if that's not the case. So first of all, I'm really cross about John's session. I have a wife called Katie. She came in when we were doing the slapping the cheeks thing. I feel bruised. Then she disappeared. And when we were doing the pinch the jawline, she suddenly came back. So yeah, they're highly effective. You just need to make sure you do them on your own. No, it was a good session. I just want to go back to a point that Thomas made around the introduction of Canopi and the evolution from Health for Health Professionals Wales. It is incredible that we're sort of nearly at capacity. And yet, do you know, Canopi, we thought that would be the case. I can remember, and I'll give you a bit of an introduction in a moment, that I was in a previous role working alongside a commissioning group in Surrey, and they were creating 3 community hubs that had social services input, community health input, as well as NHS input. And the idea of these 3 community hubs at X million each was that they would reduce the demand on acute services. And that was around outpatients, clinics, and so on. So the first one was launched and it was a huge success. We got more people in than we ever anticipated. People were using this community resource and coming to this place, and it was great. So we launched the next one. Now, one of the things was that the measures were not sound, because, you know, that when we were about to launch the third, we realized that the numbers still in the NHS hospital outpatients clinic was still rising. And what had happened is that we had launched into an unmet demand, an unmet need in terms of that community. And that's going to be true, isn't it? With the mental health delivery, service, how we help those people. When we reach out both to NHS and social services, there's going to be a demand there that we don't know. But what I think is just amazing is through what we're doing with Canopi is that we will begin to understand, and unless you know your business, you cannot deliver good action that delivers benefit. And I'm just going to go back and I'll repeat these at the end, that Thomas said, you know, how can you let people know? That was one of his first actions or requests. And 2, do you fancy joining the team? I think there's more unmet demand out there, and we'll go through that a little bit now. So in a minute, I'll share my screen. And the first thing on the screen is an agenda or some considerations through this session and an introduction. So yes, I'm Jeremy Brown, and Naomi said that, I've worked in the commercial sector, I've worked in the public sector, the voluntary sector, lived in India for a year with my wife, and I have 3 boys who are all a bit older now. I'm, rather old, unfortunately. But I also was a director of ops in a hospital before moving to Wales, and was the director of Ceredigion in the Haldar Health Board, and then worked with a company, which is the company I was just describing. And now I manage a group of care homes across the UK, in Scotland, England, and Wales. And I love what Canopi are about, what they're trying to achieve. And what I'm going to share over the next sort of 20-25 minutes is that they're just considerations. They're just experiences that I hope make you think. And then if that makes us think, what are the things that we need to do to try and take things forward? So I'm going to share my screen. This is always a bit clumsy, so bear with me. Hopefully it'll come up. I'm now going to tell it to start the slideshow because I hadn't done that already, but then hopefully we'll be ready to go. Okay, so I'm hoping that's come up on your screen, and that people can see that. I'm going to just close this down as well, because sometimes that comes up as a grey bit over your screens. So the introduction. I also ought to tell you that my wife was a midwife in England. She's a prescribing nurse in Wales. She works in a GP surgery, has worked in hospitals as a nurse too. So there's sort of an understanding there of both the NHS and social services. When I worked in Ceredigion, we worked a lot with end-of-life care, as well as community teams, and all of those were fundamental in creating the care that we need for our communities. I've put in here that there are new words. So as I said, these are just considerations. These are to make us think. I could have chosen lots of words, but I've put in here some new words. So I don't know, maybe you all knew the word pandemic before COVID came. So I asked Naomi and her team, what would be helpful to share? And it's looking back over COVID and thinking, what did we learn? And what does that mean in terms of the well-being of our people going forwards, in terms of our leadership? And at the end, we'll come to the fact that we're all leaders in whatever roles we're in. So I first came across the term pandemic when I was working for Sainsbury's. That was my first job, and did store management, regional management with them. And I've got it out on my iPad here. It says an epidemic is a disease outbreak that is rapidly spreading in a limited region. And a pandemic is an epidemic that is actively spreading to multiple regions across the globe. So I can remember, I can tell you his name, in Bob Mortimer style. His name was Ian Elkins. And he said, look, I want you to take the culture of what you're doing and make it a pandemic. And he was explaining the difference between epidemic and pandemic. And this is what I want you to do. I want you to take this and spread it everywhere. That was his sort of message, probably a misuse of the word. However, that was my first introduction. And do you know what? we didn't even have pandemic on our risk register at Sainsbury's, at the NHS, at the care homes. It wasn't on our agenda because, yeah, for sure, the impact would be massive. But actually, the likelihood was so low. Oh, what if? Now, pandemic is now a word that is very current, isn't it? We're all familiar with what it means through experience. Let's go on to the next word. Right. So if you said to me, Jeremy, the word Zoom, I would have said, oh, yeah, no, I read that. It was in the Beano. And it used to have ... Zoom or Zoom ... You know, it would have been something that was describing an action. Not anymore. Here we are. We're on Zoom. It's got a whole new meaning. And I'm sure lots of you did not use the word in the way we use it now, but it's taken on a whole new meaning. Furlough. You're familiar with the word furlough. The reason I say it like that is because that's the first time I heard the word furlough. Yeah, how do you even say it? And yet furlough became a new word, didn't it? In terms of how people were compensated for the things that we went through. And unprecedented. I've actually heard it a couple of times in the news in this last week, where they say, you know, we often use the word unprecedented, and you know, this is with the Israel-Gaza conflict, but there are more things in our life today that are unprecedented. If you look at famines, you look at earth, we don't really know about the earthquakes in Afghanistan because there's other news that usurps that. But there are thousands that are affected, unprecedented. And all of these things have affected people's lives. And as I said at the beginning, this is just a bit of a consideration in terms of making us think. COVID behaviours. You see, we have a number of care homes in Christadelphian Care Homes, as I say, across the UK. The first action we had to do was stop people wearing face masks because we were told not to wear face masks. That was the government guidance. And then all of a sudden we had to try and get everybody to wear face masks. And that was a challenge. And PPE and do testing and so on and so forth. I can remember when we were coming out of that, that we thought, oh, fantastic, don't have to wear masks anymore. How good is that? But you know what? We had to really put effort in to stop people wearing masks. And now we're in a place where we're trying to say to people, no, please don't test. If you test, we have to manage through the guidance you as a vulnerable person. And that's the only guidance we've got. So all the time, this guidance that we have, we're asking people to do this thing here, then that thing there, and then we change it. And I just went into, this is from the NHS website, you know, schizophrenia. Think of how COVID has changed our population, our society, our civilization, our communities, and maybe our families, losing interest in everyday activities, not wanting to look after yourself and your needs. Third bullet point, wanting to avoid people, feeling discontented from your feelings or emotions. That's what schizophrenia is by definition. Can you resonate that with what our society has been through? This again is dissociative disorders, being disconnected from yourself and the world around you. This is all linked with mental health. Just go onto the NHS website and you'll see it. feeling uncertain about who you are, having multiple distinct identities. Katie, my wife, she was going to see a person who would only take deliveries from their garage, his garage, because there was a connecting door, and would take the groceries through that garage, wash every item. And when she was going to do a jab with this individual, you can imagine the complication, and had to go in. But in the end, created a bit of a relationship, and she's allowed in the porch of this gentleman's house. His wife died at the beginning of COVID. You can't change that. This is part of where we are, but this gentleman affects society and the community and his family. And that's what the impact of COVID brought about. This is from the Health Foundation, and I was talking to somebody from New Zealand who is fulfilling her nurse qualification here. But this article, which is, it's old. It's back from the 18th of June 2020. But just look at those impacts that they were looking at, those headlines. Social isolation, working in a frontline service, loss of coping mechanisms, and reduced access to mental health services. So that last point has got to be what Canopi is about. We've got to help that, and comes back to what Thomas said at the beginning of our afternoon together. You see, with running this group of care homes, I joined a year before COVID hit in. I felt that, I was very fortunate that my experience gave me great experience, I guess, to take into this care home provider. And I was able to bring the commercial experience, the private, the voluntary experience, the public sector experience. It all felt good, but nothing prepares you for COVID. And we also learnt loads through COVID. So communication was a massive thing. We grew as a team when we went through COVID as a group of care homes. Some of them didn't know each other. They all know each other very well now. I can remember one weekend back in 2020, around October, I cut up, this is sad, but just go with it, all right? Cut up loads of balsa wood and sent kits for every manager and assistant manager to make a balsa wood plane, either with a resident or with their families or whoever they needed, but they had to do it with somebody else. Then they had to create a video. Just amazing. And so we learnt how to do things differently. But I also remember, Zoom is in many ways very clinical, isn't it? I'm sure all of you have had experiences where when you meet together, there is a different dynamic. But I actually felt emotion through Zoom. And I can remember at the beginning of COVID how there was a manager who came on and 3 residents had passed away in 24 hours. And you could feel that on the Zoom call. It was palpable. It was incredible. And very, very sad. And as we went through that, there were different times where there were real big challenges. But the snakes and ladders analogy is important for what we're considering today. I put that on the screen just in case you've never played Snakes and Ladders. That's a Snakes and Ladders board. If you want to buy it, it's from John Lewis, and I can't remember how much it is. But when we were going through COVID, do you remember you sort of felt like we were getting a bit of release? You were able to do this and then this and then this. And it felt like you were getting up to the third row, fourth row. We got to square 91. But then what happens is that you might get in this board to square 96. And can you see that snake? It goes all the way down to 33, or you might get to square 98 in this analogy, and it takes you back down to square. And that's how it is. A few weeks ago, we had a home who had an outbreak in Scotland, and we had our Zoom call. We have that every week with all the teams, and the Scottish home all came with their masks on. And again, you could just feel this palpable energy dissipate. It was just horrendous, because it takes you back to a place of memory, to a sense of loss, to a place where we were all restricted in what we can do. And that's something that we have to manage post-COVID. And I say that, that's not a reasonable statement. Living with COVID is the right statement. So that Snakes and Ladders analogy for me fits. And I think that when you look at our NHS staff, our social services staff, they are contending with that day in, day out. And it's a good way of thinking about how the energy is just sucked out of an individual. So let's try and be a bit more positive. All of us are leaders. We could be leaders in our families. People follow us. People will look at us for example. And that is true in all of our roles, whether they be our sort of work life or they be our home life. And we've got to understand that. And so making sure that we are leaders that show the right actions or are able to give the right leads is fundamental. And I've just put here adding value and feeling valued. You'll see on the previous slide, it said reaching out. My brother-in-law is a head teacher of a school, and they've also sort of felt the effects of COVID in the same ways that I tried to articulate. But I think as individuals, how do we make opportunities for people to add value? Because if you get that right, then they will feel valued. And that feeling valued is so important. If you go back to the COVID behaviours, and I'm not going to put the slides up again, with those things around schizophrenia and disassociated behaviours, then it's about getting people to feel valued. As Naomi said, I'm the chair of a housing association, United Welsh, and we have over 6,000 houses, and all different types of people with differing situations live in them. But as an organisation, we absolutely found ourselves on values. And we have a values word map. Things like integrity and care are fundamental in what we do, as you'd expect. How do we, as United Welsh, now ensure, when we live in a more Zoom world, a more virtual world, how do we show those values? I can show care when you're in the office by making you a cup of tea, for example, or finding you a chair, making sure you've got somewhere to sit. What does that look like when we're in the virtual? We've got to think about things differently so people can add value and therefore feel valued. I've introduced you to some of my family. Thankfully, they're not around at the moment, so I shan't be in too much trouble. But I also have a sister-in-law. She's lovely, gorgeous. She has Down syndrome. And if anybody teaches you value, then it would be her. Her name's Amy, and I can remember employing her when I was working in Sainsbury's, and I had a colleague who was quite challenging, let's put it that way. When Amy came in, she was the lady who looked after her. She was able to add value, and she felt value. I saw a different person. Amy now works within our care homes as well, and we're seeing the same impact. You see, we need to find ways in which we can help one another in our leadership. So coming back to Naomi's point and the team's point, how do we sustain well-being? We've got to think differently. And Canopi will help us with this. But we've all got to do it as individuals in our leadership. This is where you get to the point. This is an opportunity. When we look at where we've come to through COVID and what we're living with now, this genuinely is an opportunity. We have to work out how we look after one another, how we ensure that people can add value so that they feel valued. And it's a tough thing, and we've made it more difficult because of the virtual things that we're doing, he says, on Zoom, which is slightly ironic, isn't it? But I think that when I look at our care homes, when I look at GP services, when I see what's going on in the hospitals, whether it be the detox at the end of the hospital chain, as it were, or those coming into A&E, it's where people can't add value, where we get those real challenges because you feel you're not able to add that value. So I said at the beginning, this is just about thinking. This is for consideration. I'm sharing with you my experiences. I'm sharing with you some of the things that I think are learnings from our times with COVID, that snakes and ladders stuff. And what I feel I need to do with the organisation that I work with is find ways, better ways, different ways to ensure that people feel that they can do their role, that they can add value, and therefore that they feel valued. And actually, that is a brilliant opportunity. So listen, coming back to what Thomas said at the beginning, those two things. How can you let people know Canopi is there? Because that will be, when people are in a challenge, that will be a great resource. How can we get that message out? And secondly, you who are listening later on, do you fancy joining the team and adding value to what we're doing? So I hope that gives you something to think about. Happy to take any questions, but appreciate you listening. Thank you very much. Back to you, Naomi.
Thanks, Jeremy. Diolch, Jeremy, am dod I siarad i ni heddiw. Roedd o'n ddiddorol a defnyddio'n iawn. So thank you ever so much, Jeremy, for speaking to us today, for sharing your reflections and the lessons that you've learned over the past few years. I'm going to pass on to Thomas, who's just going to quickly talk about how we're going to gather some feedback, and then we will definitely have time for some questions. So if anybody's got any questions, please continue to pop them in the chat for us. Thank you, Thomas.
Thank you, Naomi. Thank you, Jeremy. Thank you, John, for contributing to our symposium this afternoon. I enjoyed listening to you, Jeremy, very much, the challenge that you set us. And to John, I, being entirely honest and open here, was surprised how much I enjoyed doing some of the face yoga that you did with us. So I share that with a smile and a genuine thanks for opening my eyes to how poor or how weak some of my facial muscles are. I should smile more. There's been a few questions that have come up in the panel chat while we've been on today. What I'd like to do, just while we'll come to as many of those as we can, what I'd like to do is just introduce to you a Mentimeter feedback slide first of all. So we'd like to just pick up some of your reflections on the sessions that we've run today. So the code is there, so to get to it, hopefully people are relatively familiar with Menti. If not, menti.com, and then it will ask you to enter a code 69687531, and then you can use the QR code. Otherwise, thank you for the thumbs up to whoever that was. I'll give you just a second or two to get onto there, and then what we'll do is just go into the first of those questions. So hopefully that is enough time. I guess we can put 69687531 in the chat as well, just so that people can find that if they need to. So menti.com 69687531. And I guess at this stage we'll move on to the first question, which hopefully everybody can access. Thanks, Naomi. Really keen to hear what people thought about today in one word, and we're keen to sort of reflect that back to you. So thank you everybody for already engaging with that. That's smashing. And once you've filled in the first one, as it were, then there'll be opportunities to click through and answer some other feedback questions for us. We're really interested in hearing what you have to say in more detail, so please just take a moment if you can to fill some of those in. This is great. So thanks for engaging with Mentimeter today. As I say, more questions on the follow-up, and if there are any more specific sort of follow-up feedback things, then we're really keen to pick those up while we're here. So, right. A few questions that came up in the chat while we were going through. Apologies, just changing my device here for a second. One of the questions was about whether there's space for coaching and mentoring or supervision via Canopi. The answer is certainly. So our wellbeing allies, which I mentioned in terms of our volunteer capacity, much of what they do will be coaching or mentoring in a supportive space. Many of those, presence, listening tools, listening skills are part of what that is. Outside of that wellbeing ally space, then yes, we're keen to work on how we might integrate some group spaces around coaching and mentoring as we go forwards. That's part of what we're looking at doing. The challenge for us is doing that in a way that's acceptable to our clients coming through the system, coming through the service. So that's just a brief thought on that one. I'll try and pick these off relatively quickly, and then hopefully that means we've covered them. But are there any circumstances in which support via Canopi is not recommended? And the answer to that is yes. So we do, through our service, recognise people who are too complex for Canopi. And that's really important for us to do. We are a signposting service, and part of that signposting is to escalate cases of care to our primary mental health care teams, our primary healthcare teams, and to other specialist units as we can. So the question is, how do we do that, I suppose? And is that on scores or on a discussion with a doctor advisor? And the answer is on both. As Jeremy's pointed out, some of our behaviours in and outside mental health are complex. What's a mental health condition? What's a behaviour? What's somebody's baseline personality? What somebody's experiences? All of these things come together, which means that a holistic assessment of who somebody is and what they need is really important. So we try and combine all of that together. Another one here is around what would be recommended for staff who have experienced the suicide of a patient or a colleague. Suicide is a really destructive, challenging, difficult thing for teams to deal with, and I think that's really important for us to recognise first of all. Canopi is here to support people if they don't feel that reaching out to other services is helpful. There's a revamped service, I believe, in Wales, Help is at Hand, that people can utilise. There is a reasonable number of third sector organisations that will specifically try and help people through the challenges around suicide as well. So just to leave that with people. Another one here is about our opinion on mental health and well-being, first aiders in the workplace. Keen to pick up anybody else on the panel's view, particularly on this one, in terms of how do we use mental health and well-being first aiders. I think it's just reflecting, as Jeremy did, back into COVID just for a second, in my own experience. The experience of COVID really deconstructed our small social units that we have in our workplaces. You know, those conversations that we had in the coffee rooms or in the lunch, wherever we ate our lunch, or you bumped into somebody in a corridor or that sort of a thing. Those very informal social networks that we have, they disappeared out of my experience working clinically during COVID. They are slow to come back, but are coming back. So the idea of mental health first aiders, peer support, mental health advisors, mental health well-being allies, mental health allies, well, this whole umbrella of who people are, who can perhaps use a small amount of training to facilitate asking particular questions in a supportive, non-judgmental way, I think helps to add some of that support back into the system in a very informal way. And that's something that I think would be really positive. As I say, I don't know, Jeremy, whether you've got experience of how that might work with staff in a care home environment or more broadly.
Sure. So we do have mental health champions within our homes, and they go through a training course. It's fairly simple, but I think the fundamental piece here, which links with what you said at the beginning, is that it gives a conduit for people to have the conversation. So we didn't have any conversations before. We now have a good number of conversations where people feel they can. And beyond that, obviously in our Welsh home, they can sort of link to Canopi in some cases. But in England and Scotland, we also took out a policy with a company called AXA. Then you can link with mental health professionals there that they provide. And it's relatively cheap, but a really good resource. And then we as a company can pay more if those people want additional resource. But those champions, as we call them, have made a fundamental difference in that it's not now a topic that's closed doors. It's something that people feel they can go to somebody about. And I think that's the fundamental change.
Thanks, Jeremy. That speaks to one of the core ideas in Canopi, which is the destigmatization of mental health as a subject that can't be talked about. The beautiful thing, I guess, we could envisage going forwards is that Canopi doesn't need to exist because everybody is comfortable talking about their mental health and seeking help when they need it. So we look forward to that day and continue to work towards it in supporting people while we're waiting for it to come. And if there are any other questions around how we might introduce training of that sort of thing, we're really happy to pick those up. So thank you for that question. We should probably draw our session to a close as we're heading towards time, but I wanted to just use, Dean, your last question to us to raise my second ask just one last time. Thank you, Jeremy, for doing so as well. Dean, your question was what's entailed in volunteering as a wellbeing ally? There is more information, as Julia suggested, on the website in terms of getting involved. But in short, the summary requirements are an awareness of social and or healthcare, ideally some experience, but certainly an awareness of how the systems work. And then on top of that, willing to offer some of your time to create empathetic listening spaces for people who are essentially our peers and our colleagues working in health and social care systems in Wales. There's a little bit more to it, but I'll leave that to the document. And with that, we'll say thank you very much for joining us for this afternoon. Again, reiterate my profound thanks to John for his interactive session with us, and to Jeremy for his reflections on how we can work together to create value in and amongst our workforce. Thank you very much. And hopefully this has been an interesting session. We look forward to picking up the other information that you dropped into the Mentimeter. Thank you, have a nice afternoon, and we'll finish the session here.